about like how to go by things starting from day one, so that you gonna adjust in quicker than me, because I didn't have these guidelines. So feel free to ask any question at any point. I'll answer all of them. Okay. So first of all, congratulations to all of you. This is my favorite congratulation. Like this is the iPhone congratulation thing. So um, congratulations to all of you. This is like the first step towards being a practical doctor for a lot of people among you. I don't know how many of you have done any work in Pakistan, like a house job or anything, but this is like the beginning of your professional career. So it's something to be. Sorry, I'm hearing some interference. I'm gonna like turn off the mics. Alrighty. So again, like this is this is a time where you have a mix of emotions. You can be very excited or very nervous, or kind of be both, like this. So excited that you start to become scared. So there are so many things that should excite you at this moment. Starting a new job, starting maybe for a lot of people starting a real job first time in their life, and a new workplace that you're gonna go to, and for a lot of people, just being a real doctor, like the sense of entitlement that comes with that, and above all, like getting a residency spot in US. You know how many people they come into this competition and how many are screened out. So you are the ones who are screened in after this rigorous process of USMLE step 1, USMLE step 2, CS step 3, and after that the interview trails and ranking and stuff. So you should be excited. There's no doubt about that. So you should be like this. But again, there are a few things that scare you as well at the same time. First of all, is like the trials of intern year. How it is something that scares a lot of people. Then the responsibilities that come with residency, taking care of people in, and and then learning, and then like hopefully not making mistakes, but if you make it, learning from your mistakes. So these responsibilities come into play as well. New environment, again, like going to a new place away from family. um, a lot of people in Pakistan live in hostels, but for someone like me who never lived in hostel, like staying away from family, that is also a challenge, something that scares people. So it can make you like this, not worried but worried. But you can do it. You have done a lot till coming here, so you can do it in future as well. And how are you gonna do it? There are little few things that are thought about. I discussed with Dr. Faiz, and we're gonna talk about those. So first of all is arriving at your program. So I would recommend, today is 23rd of May. I hope most of you have taken your visa interviews. If not, I hope you'll get it done as soon as possible. I think I did on 21st May. I had a visa delay as well. So uh, just because I did it within the good time limit, despite I was delayed, I was not delayed to the point that I started my program really late. Um, it's a good time to get in touch with your co-interns right at this moment. Guys might have their emails. It's better to like ask them for their phone numbers, make a little WhatsApp group or something like that. Also, it's a good time to get in touch with your seniors. If you know anyone in the program, that you're going to get in touch with them and ask them how to settle in. Uh, Once you are here, just like be quick about finding a place to live. checking in with the program and doing the paperwork that is required. The paperwork required, like if you're coming through the USMLE ECFMG program, you're required to do the J1 paperwork, and that takes like a few days before they can like definitely check you in. And then you apply for your social security number and get a driving license. Just do these things as soon as possible, because if you start delaying these things, it just like kept going delayed and delayed further, because your routine would be pretty intense. All of your programs will give you a very good orientation. So it kind of becomes boring at times because it's so long and then there are so many things involved. But make sure you note the most pertinent point that are related to your program and your patient care. The administrative things you learn it with time, but the patient care is something that should be your priority starting from day one. Alrighty. Once the July 1st hits, then you'll be put on any rotation. I'm talking about internal medicine. I hope most of you are internal medicine. So these are like the big rotation that are part of internal medicine residency curriculum. You can have internal medicine floors that are inpatient medicine work. You could be placed into medical ICU. You could go to a clinic. Every program has different style of clinic. Some programs do it once a week. Some program choose to do like a week of clinic interposed between 4 or 5 weeks of any other rotation. So they call it 4+1 or 4+2 or something like that. You must have heard these terms when you're going for your interviews. You could be on any elective, or you could be placed on a night floor scheme, or there are some programs that don't use night floor. Instead, they use something like a call schedule in which you do your regular work, and then there is some day when you are for 24 hours or maybe more than that. Alrighty. Any questions till now? No questions? Okay. Alrighty. So these are like a few brief general rules that I think we should apply ourselves to starting from day one. First of all is know your patient well. That is the most basic principle. You should be the one who knows about the patient the most, more than your senior, definitely more than your attending, more than your nurses, more than your case managers, more than anyone. Um, in doing so, you need to do the chart review part. And then you should talk to the patient. That is most important. Um, Go and sit with the patient, talk to them, ask them what is happening to them, ask them how they are feeling, ask them if there is anything out of just traditional medicine that they want to talk about. Like maybe they're missing something in their family at their home. Maybe they're scared of being in hospital. Do a good examination, and like what I find most useful is like going back to the room as many times as you need to. That is more important. Like there would be times that you'll go to a room, talk to person, come out, and then you start looking at the chart and find something that you didn't know when you went in. Go back again and talk to the person again. Go back and do another physical examination. You might have to go to a room like three, four, five times. Maybe not for every patient, but there would be some patient that you need to go multiple times. So do that. Be proactive about that. Your number one target, your number one goal is to take care of the patient more than anything else. When you're presenting a patient to your attending in the rounds, wherever, just run it in your mind for a moment before speaking it out. Yeah, talk to yourself, talk to your co-intern or your senior about those things before presenting into the round. you need to read a lot. There are so many sources that help. Up to date is accessible to almost everyone in the hospital. So read from up to date about your topics. Uh, the Pocket Medicine is a little medicine book that helps a lot of residents. I used to have a lot of journal subscriptions, but I think NHJM and there's a Cleveland Clinic Journal of Medicine. They are very useful for internal medicine prospect. NHJM it has a clinical case. It's like a weekly journal. It has a clinical case almost every second week or so, and like going through that just like broadens your way of looking at patients as a whole, and like how to integrate that clinical reasoning into your thought process. Next is ask for help whenever you need it. There would be moments then you will ask nurses to help. There would be moments then you have to ask your seniors to help. And if you feel like the patient is it doesn't look good, it's like the patient is scary, then call a rapid response, call everyone to see the patient, and don't hesitate in doing that. Just because I'm not the decision maker, it's not you. It's not like that. You are the decision maker starting from the day one. Talk to your nurses, communicate with your seniors, communicate with your attendings, talk to your case managers. Just keep like everyone informed about what is happening, so that no one is confused. No one has to make assumptions about what is going on with the patient care. And last, but the most important one, if you don't know anything, do not say anything that is not true. Say that I don't know, or maybe the better answer is I don't know, but I will find it out. Maybe you have to go back to talk to the person. Maybe you have to talk to the nurse. Maybe you have to read something. But just be honest with whatever you do. When you are on medicine floor or on a IC rotation, you have to do like an admission and discharges. For admission, I can't talk about much about history and examination. You guys know what it means, gathering the information from the patient. However, there are two things that are very important when you come to a medicine floor in US. One is getting to know what medication people are taking. You have to know that. This is like one of the most crucial steps in taking care of the patients. And if you miss anything on this, then definitely the patient care would be affected. So the resources of checking the medication, you'll have your EMR, you'll see the medication list in that. I have never trusted the medication list in electronic medical record. Always confirm with the patient. Always confirm with the patient. Always confirm with the family. The other sources, you can call the patient's pharmacy. Like the pharmacies here are available almost 24/7 more, and if not, they're at least available for like 16 hours a day. So call them and ask them about hey, I see these medication on patient's list. Is it true? Is the patient taking the same dose as listed in here? If you cannot find any way, even not pharmacy, then you have to call the patient's primary care office and get information. Do not sit back on patients' medications, because they are the biggest reason the patient get admitted. They are the biggest reason that the patient get discharged. And there's something called a court status, which you have to ask everyone when someone gets admitted. It is like their wishes of resuscitation. No matter the patient is sick, no matter the patient is coming just for a finger laceration or a tooth pain, anything, you have to ask them if any time a situation arises that you have to be resuscitated, that your heartbeat is to stop or your breathing is to stop, and patient won't mind this question because they know this is very important. Like, what do you want us to do? Um, I always ask about like, do you have any substitute decision maker in that case, or do you have a paper stating your way or your wishes, or the other thing is like what do you want us to do? And even if they have a decision maker, even if they have a healthcare proxy, even if they have everything in written, still you ask them what do you want us to do in those situations in which we have to resuscitate you? Do you want us to do chest compression on you? Do you want us to put a breathing tube in you to get you to revive you? Do you want to be hooked on a ventilator? If they say yes, that is an easy answer because you know that is a standard protocol. But if anyone says no, then just stop there and ask them, what do you mean about no? Because they have to know that not doing those things in that situation will result in their death. They'll just say like they have to know this part, and then you have to further clarify what they want to do in those situations. Like if is everything a no, or would they take some things? Would they be good with taking the NG tube, getting artificial nutrition? Are they okay with IV fluids even? Are they okay with IV antibiotics? So clarify with them everything if the patient says no, and all of them are usually in your built in your Epic or whatever EMR system you use. You cannot admit a patient without their core status most of the times. Alrighty. Discharging a patient is as important as admitting a patient. Admission and discharge are the points of like a new uh, encounter with the patients. So be careful about those things. So first of all, in Pakistan, we just know about like patient either goes home or the patient comes to hospital, but there are so many options of their discharge in here. So when the patient comes in, when you admit the patient, start thinking about, okay, where this patient is gonna go. Is the patient going back to home? Is the patient not going back to home? If not going back to home, the patient might go to a skilled nursing facility or a rehab facility or a group home. These are different levels of patient independence. How do we determine these things? We have like physical therapists and occupational therapists. They work with people while they are in hospital, and they determine how much their capability is to take care of themselves at home, or and how much help do they have at home. So you have to ask people about these questions. Where do they live? Who lives with them? How much support do they have at home? Maybe a patient is like really debilitated, but they want to go home and they have 24-hour support with them. So those people, despite being debilitated, can go home if they want to. But if someone lives alone and they get debilitated, then they probably are not safe to go home. They will go home and come back in much worse state. So you have to send them to a place where they can get better and be independent before going home. The case managers are the one who will help you with setting up places for people. Be respectful to them. Always ask them about their prospects. They will be working with insurance and help you with sending people to the respective places. Um, be proactive in discharging people. Like start discussing about discharge plan early. It's tough. It comes with time. Maybe for the first 1 or 2 months you won't have much idea, but once you integrate into the system, be proactive. Start talking about, okay, where are we gonna send this person to? When are we gonna send this person? How long what are their medical needs to stay in hospital? Is there any way these things can be done at any place not hospital? And like get people out of your hospitals. Hospitals are really dangerous places to live in. The mortality rate of any place in the world is higher in hospitals than anywhere else. So just uh, keep your patients safe by discharging them as soon as possible. And by possible, it means as soon as it is safe for a person to go to somewhere else. Alrighty. Any questions till now? No? Okay. Alrighty. Um, Medical ICU is one of the most scariest place to be at as an intern, because you see like real severe disease, and the disease spectrum it's not like really broad, but it's severe. Uh, you see a lot of people coming in, getting intubated, especially in these circumstances when there's so much of a new thing around. You see unexpected persons that you really do not want to see in medical ICU coming in ICU. So it becomes like really stressful at times. But the good news about medical ICU is you have a lot of help. Your nurses are not overworked. They will have one patient or at max two patients. Um, you have your seniors, you have your fellows, you have your attendings. So there's a lot of layers of comfort in medical ICU. The most important thing in medical ICU on your part or on an intern part is a lot of people may be intubated or debilitated to the point that they cannot talk to their family. So you have to like discuss their care with their family all the time. And among these, and then the sort of core status we talked previously on hospital admission becomes much more important in ICU because there are people who will come to ICU and then they might have to be on ventilator for prolonged time, or there is a chance that they never recover. So you have to give the most honest opinion, your professional opinion to the family, and show them what it means, and show them how the prognosis of a person looks like, so that they can make the best informed decision about their patient's care in accordance to their patient's wishes. So these conversations are hard to do, but you kind of have to master them because that's the only way you can survive in a medical ICU. Oh, your clinics. Your clinics are exciting because you develop long-term patient-to-physician relationships here. You see patients for the whole length of your residency. You will have people that you start on day one, and they will go with you for 3 years, or if you do an extra year, they will go with you for 4 years. Um, so here you have to be the advocate of the patient. If you start a medication, if you do a specialist consult, just make sure that you are the primary decision maker for the patient. Like talk to the people about their medications, about their health, about their social well-being, everything. You should know everything about your clinic patient out of their medical needs as well, so that you can make the best decisions for them and you can provide the best care that is suited for them. There would be people who will do whatever you will say. There would be people who would never do anything that you say. So you don't have to be frustrated. You have to find out the reason why is it not happening and help them with all of that. Another important aspect of clinic is screening and healthcare maintenance. You would have abundant time to discuss all those things that you learned in during your USMLE about doing a colonoscopy or doing a low dose CT scan for lung cancer screening or PSA or giving them vaccinations. So make sure you apply all those principles here. Electives, the most important thing about electives is ask for the electives that interest you. Like if you're gonna do cardiology, start asking for cardiology right now. Not Don't wait till you start so that you can ask your chiefs about that, and then they tell you that they're not available anymore. So start asking for electives right at this moment. Go by your interest. Um, and maybe at times do something that is kind of related to your work. For example, if someone is doing hemonc, they should do a rotation in transplant ID. Maybe if someone wants to do cardiology, they want to do something in pulmonary as well, so that they know the related principles. And the electives are good because they teach you a subspecialist role and how would you be if you end up doing a fellowship. Educational activities are abundant when you start your residency. Every program have their own style, but most common things are morning reports. They happen usually in early in the morning sessions, um, mostly case-based discussions. But your chief might just switch it around to make it more interesting for you guys. There are noon lectures and grand rounds. Then there are journal reports and journal clubs, and there are so many other things that your program may do itself. The principles are be proactive, participate, answer questions. If you don't know, ask questions. Like you should make your presence feel. I know all of you are amazing. You have great scores. You know a lot of things, but here the purpose of residency is to learn how to apply those that knowledge that you have developed in the 5 years of MBBS and maybe a year or two of USMLE and your electives and everything. So learn be come with a growth mindset. Like, okay, you won't know everything, you won't know how to apply, but at learn asking question and answering question is a big part of learning. So keep doing that. Alrighty. So next thing is, what do you want to do with your life? Decide it as soon as possible. It is great if you have a decision right at this moment. That is highly recommended. Even before you start your residency, you should know. But there would be people who won't be as sure as others are, and it is okay to do some window shopping, like to see how other things are. Um, but you should have a decision in 6 months from now. That would be ideal. If you're going to a competitive specialty like GI or cardiology or hemonc, you should go for a lot of research. You should ask for um, research opportunities in your program, reach out to people, reach out to subspecialists, your fellows if you have in your program, and offer them help. Say that, okay, I know these things, these are my skill set, and I can do that. Uh, do you have anything that I can work on? And there would be a lot of things that the fellows and attendees would need help with. So you will get a lot of opportunities. Another important thing is maintain an updated CV. A lot of you people have done a lot of work like Ali or Saad Malik, so you will have a lot of things on your CV, and then you guys will keep publishing when you are working during your residency. The biggest problem will become when your ERAS application for fellowship comes and you don't know what you have done. So don't let that thing happen. Make sure your CV is updated. Just make a little copy of a little CV, resume in your computer right today. Put everything in that. Make a section for research activities or like your bibliography, and then whenever something on your name gets published, just put it in there so that you know what you have done. If you want to do hospitalist or primary care, there are specific paths in residency tracks. There are, like our residency track has a path for inclusion health, which is for underserved population. So if you want to do that, if you want to explore that, make sure you ask your program early. Okay, so the most important thing after educational activities is your wellness. You have to be strong mentally to come and adjust here, and at the same time, just not get into the flow and just lost what you are. So there are cultural differences between us and the people here. So how to negotiate that is number one, be respectful. Uh, like just accept that there are people who are different from what you think, um, and adhere to what you are. Don't lose your identity. Like that is the worst thing that you can do to yourself, to split your identity into like being what you are and then being what you want to become. People will respect you no matter what you are, if you keep yourself and learn about diversity. It is amazing to see how how diverse your residency program could be, how many different cultures they accommodate, and when you start learning, it just becomes a really nice thing to do. Make sure you have time for your family and friends. Talk to your family. Now there are so many options that we have. Fortunately, we can call through video call, or we can call anytime. It doesn't cost as much as it used to be about 10 years ago. So take advantage of that. If you have a family in US, if you're coming with your family, um, there would be times then that you won't be able to spend with your family as much as you would like to, but take every opportunity of going out with your spouse, with your family. If you have kids, going out with them. Um, it helps you to keep focus on work, and like keep your work at workplace and your family at home. Do not like intermingle those things. Find some activities out of medicine to do. You can involve your peers, your co-residents in activities, um, establishing a book club, or cooking classes, or whatever. It will keep you mentally strong and physically healthy. Make sure you sleep well. There's nothing more relaxing to human body than a good night's sleep. So do not compromise on your sleep. Make a good sleep schedule. It's very hard to do. It's easier said than done, but it is very, very important. Find some time to do exercise. Do not start gaining weight in residency. Don't end up 30 pounds bigger than what you were before the start of residency. Um, like there are so many things that you can do. Like you can ride at these moments. Even the gyms are closed. You can go and walk outside, run outside, um, and then do at home. Maybe make a little group of your co-residents. There are gyms in hospitals as well. There are a few hospitals that I know that have like places to do exercise. As soon as you get off of work, you can go there and do something before you come home. Just make a little schedule for yourself. Okay, I'm gonna do that at least 3 times a week, or at least 4 times a week, if not every day, and just adjust your life routine around that. Alrighty. If you are a Muslim and you pray, do not stop praying. You can get ample time doing that, and that is part of your wellness as well. Financial things. So this would be first time a lot of you would be earning something. So it is important to just a minute. Um, so what is important here is like make sure you don't just like end up spending everything that you get. So be wise about those little things. Discuss with your family about your finances. If you're living if you go to some big city like New York, you probably won't need a car. But if you go to a smaller place, it's better to get a car as soon as possible. And having said that, get your driving license before that. Options for those are you can lease a car, you can finance a car. Um, in residency life, I would recommend leasing over financing, because financing can stress your financial resources. But it's up to you. If you go to a smaller city, you will have enough money saved, so you can do financing as well. Health insurance, it's very, very important. Maintain a good health insurance for yourself and your family. Um, for the people who come on J1, health insurance is absolutely mandatory for every single day that you're here. So even after you're done with your residency, but even if you're on H1, don't just skip that. It is very important to maintain. Um, for living, the living, just like it should match with your living style. If you're living with your alone, you can just rent a small apartment and live there. You don't need a three bedroom house. You won't be able to take care of that, especially when you're an intern. But if you are living with your family, then you probably should think about a bigger apartment versus a townhouse versus a real getting a home earlier when you start. The thing about like the apartments are if you stay close to your workplace is probably be a bit more expensive, but as you kind of space out, move out, and um, take the driving early in the morning over, you might be able to save some money and kind of spend the same as a one bedroom apartment would cost in a busier part of the city. There are so many retirement plans that you can enroll to. It depends on what your program offers, but make sure you explore all of them. Uh, and the bigger thing that I would say is charity. Help others, especially if I remember a lot of people who helped me when I was applying for residency. So I kind of try to pay back as much as possible. If you're living in a two-bedroom apartment and there is someone that you know is interviewing or doing things like observership or anything in your city, offer them help. It goes a long way, really. Alrighty, if you do all this, then the sky is the limit. Like as you will put in, you will get as much out. And that is my talk. I'm open for any questions. Thank you, guys.
Assalamu alaikum, Urvit here. I have a couple of questions. Can I ask them right now?
Yeah, sure. Go ahead.
Okay. The thing is, I also matched in Allegheny General Hospital this year.
Oh, congratulations. Welcome.
Thank you. Thank you. I just had a couple of questions that were pertaining to to this particular program, and then just some general
Uh-huh.
questions. So I'll just start with the general questions first. You
Uh-huh.
mentioned some of the resources for learning during the residency, like up to date and pocket medicine and everything. Are there any additional ones that we should be aware of, and that will help us? Um,
Uh,
yeah.
okay. Like other things depend on your taste. Like Mixapp is a big resource that people do, but it's probably more related to medicine boards than anything. Um, and what else? Like whatever journal you like. JAMA is a big resource. The American College of Physician ACP membership. A lot of programs will buy you ACP memberships. Allegheny will buy you ACP membership only if you present in their conference, um, which is not that hard. So, uh, like but I think like consistency is bigger than having more resources. If you have one thing, just keep working on that, and then you'll be good. Like it, you just continue reading up to date on as many topics. Up to date for me was really frustrating at times, but it is the best resource that we have. Learning, like you can go to the guideline pages of the KidGo guidelines for kidney or AS American Association of liver disease website and read about their guidelines. But it just like depends, and you'll find a niche around what you want to do. There's an application called Journal Club, Wiki Journal Club or Journal Club that you have to pay around $7 for lifetime access. It is amazing thing to have as well. It gives you a lot of clinical trials and how to read through them. So these are few resources that I used, and then you can discuss with the team around, and then you can find other things as well.
Okay. Thank you. I have a couple of other questions too, but you can take questions from other people first because I have a
Sure.
list of questions.
Alrighty. Alrighty.
Can I ask the next question, or should I
Oh, sure.
first
Go
give
ahead.
someone else? Oh, okay. My second question is about the research work because the thing is, I'm currently not sure what I exactly want to pursue. I'm kind of confused between two specialties, and both of them are really competitive, either GI or HEMONC. So
Mm-hmm.
So I was just asking you, what are the research opportunities that are available in AGH in particular, and also if I decide by the end of the 6 months of my from the beginning of the residency, would it be too late to pursue either of the two?
No, it won't be too late to pursue if you decide in 6 months. The most important thing is to decide in 6 months. Um, you will have ample opportunities in AGH. I think once we are done with this class, I can answer your questions more better about like our program. That would be better for other people as well. I don't want like that is just limited to the program, so we can discuss it later.
Oh, okay. And also, how did you find the learning curve during the first, months of the residency? Because generally, whichever program I interviewed at, they mentioned that the initial months of the intern year might be a bit tough. So, what was your personal experience?
Oh, my personal experience was like I was fortunate that I started in the ED, which where they didn't expect a lot from me because I was not their resident. I was an internal medicine resident that was rotating in ED, so I kind of got a sense of starting on medicine floor even before I actually went there. But even if you start on a medicine floor or a night floor or ICU, you will the basic principles are the same. Learn good about your patient, know everything, um, be respectful, and ask for help whenever you have to. And it's a steep learning curve. You will start learning from day one, and you'll keep learning every day.
Oh, okay. The rest of my questions are pertaining more to the program. So
Okay.
maybe we can discuss
I
it.
think yeah, I think we should give chance to other people to ask questions.
Okay, thank you so much.
Hmm.
Thank you, Salman bhai. So I have one question. What
Uh-huh.
are some expectations that you have from an intern at, let's say 1 month and then 3 months and six
Uh-huh.
months? What should we be targeting at, in
Oh,
terms of
all right.
dealing with the EMR and let's say it's clerking the patients or putting in orders? Like, can you set us like a certain milestone set, like what something that we should be comfortable with by the end of a month, by the end of 3 months, by the end of a 6 month time? Do you get my question?
Yeah, that is a great question. If I'm like starting on with new intern, like my style was when I was a second year, I was like doing everything myself and like not giving any chance to my interns, which I was like told during my rotation as well, that you are like taking care of all three people yourself and not letting them do anything, because I was just too scared that they might make a mistake. So that was my error. But when I did it in my third year, I just like I told my interns on first year that you are okay doing anything that you want to, just let me know. Like that is my expectation from everyone. Like they do anything that they want to. Like if you want to do an order, if you want to do um a CT scan for something, okay, go ahead, but just let me know. Like my expectation is for you is as an intern in first year, first month would be just keep thinking about the problem and come up with a plan and discuss with me. And if it would be reasonable, I'll never stop it. I'll let you do whatever. The thing about in medicine is medicine. There are so many times when there is no real yes or no answer. You have to take a path and see how things go, and then you can circle back anytime. So for first month, my expectation would be, okay, you have 7 patients or 8 patients or 10 patients. What is your thought process about that? How do you approach the common medical problems? Do you have adequate knowledge? And I'm pretty sure anyone who is coming from Pakistan will never have any problem with those things, because we come from a place where everyone reads definitely more than people here. My expectation by 3 months time would be like, how do you put things together? Like how, like if someone has like 10 problems, how you make one disease out of those 10 problems. And my expectation by the end of first year would be you should be knowing more than just your patients, maybe some things about the other interns patients, like so that you can take a role of leadership by the time you start your second year. Again, the things we discussed, going back to the patient's room, asking them question again and again, not hesitating going back to nurse and ask them, oh, I forgot this thing. Not hesitating asking your attending, I don't know, but I'll try to find out this answer. These things I think make a lot of difference. They are very, very helpful. For EMR, you said you learn EMR. There's like EMR is like I don't know how to describe it. It is a sweet headache. Like you cannot get away with it, and it helps you so many times, but it kind of like wastes a lot of your time as well. So you will learn it. There's whatever EMR you use, you will learn it. People tell Epic is the best. I have not used any other EMR, but I don't find Epic very useful either. But it is what it is. Shahryar is asking, is there anything you can do to make yourself like I am? Like, what is I am, Shahry? I'm still not understanding your question. Like, make yourself like internal meds, like an attending. Shahryar, can you speak?
अस्सलाम वालेकुम।
Okay. वालेकुम सलाम।
हाँ जी, तो माय क्वेश्चन इज कि आप मतलब कोई ऐसी प्रैक्टिस बता सकते हैं अपने 3 सालों से जिससे आपको ज़्यादा शौक पैदा हो इस स्पेशलिटी में एज अ होल, और जो आपने चूज़ करना है फेलोशिप के लिए उसमें क्या आप केसेस किस तरह रोटेशंस कैसे चूज़ करें या इलेक्टिव्स किस तरह, क्योंकि अगर आप अनश्योर हैं पूरे मतलब आपको नहीं पता कि आपने क्या करना है या आपको क्या पसंद है, तो what do you think is the best way to go about it?
Like the best way to go about is explore as much as possible and explore it early. Like even if you are on a medicine floor, you'll be consulting GI, you'll be consulting the hepatology team, you'll be consulting the hematology team, pulm team. You'll be doing medical ICU, which is part of pulmonary and critical care curriculum. You'll have people who have acid bed disorders, people who have electrolyte problems, volume issues, getting dialysis, conduction abnormalities, heart attacks. So you will have a mix of everything. So see what attracts you even when you are not on an elective rotation. But the elective rotation is something that gives you more insight of how the life schedule of attending looks like. Unfortunately, you cannot do every one of them when you are an intern. So just just choose the ones that you are interested in. At least make a little list of things when you are doing a medicine floor to see what attracts you, and then explore that elective. In choosing interest in internal medicine, I would say like reading about cases and seeing how people think. Like Dr. Faisal Masood used to be someone. He was someone that I used to see and say, okay, if I become a person like this, then it would be really cool. It would be amazing. Just because like they like how it's not like knowing everything. It's more about like how you put things in one perspective. That is something that attracts me. Even here, like you see a person coming in and doing a physical exam that you never thought about, and you say, oh, how it crossed his mind. And then those are things that increase my attraction to medicine.
Sahi, thank you.
Hey guys, more questions? Okay. As much as you make it, as much as you make out of it. If you make it difficult for yourself, then it is difficult. If you don't make it difficult, then it is not. So for me, I would say two, maybe three, maybe not more than that. Alrighty, more questions? Is there anything that I need to talk about in more detail in my presentation? Anything that did not make any sense? Alrighty, guys, no more questions? Alrighty. Thank you, guys. Welcome to residency. Welcome to this part of life. You guys will do amazing. In case you have any troubles, any problems, anything that you cannot discuss with anyone, I'm always available. Dr. Faiz is available. There are so many people who can help you in this forum. Just keep in touch. Even if you do not want to pursue HEMONC, that is absolutely fine. Um, just stay in touch and welcome. Thank you so much.